Welcome to the Deep Dive. Today, we're diving deep into behavior therapy, and we've got a fascinating chapter from the American Handbook of Psychiatry to guide us. It was written by Joseph Wolpe, a real pioneer in this field.
Oh yeah, definitely a big name.
So we'll be unpacking what behavior therapy is all about, how it works, and why it matters to you.
Right?
And we'll be pulling out some really interesting examples from Wolpe's work along the way.
Yeah, it's amazing what he covers, like from the basic principles to specific techniques.
Yeah.
It's a real foundation for understanding behavior therapy.
So let's start with the basics. What exactly is behavior therapy?
Oh.
I feel like we use the word behavior all the time, but
Yeah.
here it seems to have a very specific meaning.
It does. It does. It's not just about, how you act at a dinner party.
Right.
Behavior therapy really zeroes in on this idea that a lot of our issues, particularly neuroses, they stem from learned habits. So instead of digging into you know, deep-seated childhood issues or unconscious desires, it focuses on those habits
Hmm.
and how to modify them using the principles of learning.
So it's almost like saying we can unlearn our problems.
In a way, yes.
Hmm.
And what's fascinating is that Wolf points out that this applies to a surprisingly wide range of issues.
Oh, okay.
Not just what we traditionally think of as mental illness.
Right.
It could be things like nail biting, procrastination, even certain learned behaviors in people with schizophrenia.
Hmm.
The beauty of behavior therapy is its adaptability.
Are you saying even therapies that aren't explicitly about learning
Right.
might actually be working through learning processes?
That's exactly what Wolpe suggests.
Wow.
He argues that even when therapists aren't intentionally targeting learning, the interactions with their patients
Right.
can inadvertently lead to learning and habit change.
Yeah.
It really makes you think about how constantly we're learning and adapting, often without even realizing it.
It's kind of mind-blowing when you put it like that.
Yeah.
But before we go too far,
Sure.
let's define what Wolpe meant by neuroses.
Okay.
Is it just another word for anxiety?
It's closely related,
Okay.
but Wolpe's definition is a little more nuanced.
Okay.
He sees neurosis as this persistent, unadaptive habit
Mm-hmm.
that's acquired in a situation that causes anxiety.
Okay.
And the anxiety itself becomes like a core part of that habit.
So it's not just feeling anxious in the moment.
Right.
It's more like developing a patterned response.
Exactly.
A habit that's rooted in that anxiety.
Precisely. And here's where it gets really intriguing.
Okay.
Wolpe says that the anxiety might actually be hidden beneath other symptoms.
Oh, interesting.
So, things like sexual issues, asthma attacks,
Wow.
even certain personality quirks, behavior analysis can often reveal underlying anxiety driving those issues.
That's so interesting. It's like the anxiety is the root, and these other issues are just the branches growing from it.
Exactly.
I'm starting to see how this approach could be applied to so many different things.
Right.
But how do you actually go about changing those habits?
Well, that's where those learning principles come in.
Okay.
Wolpe breaks down several key paradigms.
Okay.
You've got positive reinforcement. Think of it like giving a dog a treat for good behavior.
Okay. I think we can all relate to that one.
Right.
What else?
Then there's negative reinforcement, which is strengthening a habit
Okay.
by removing something negative.
Okay.
Imagine taking a painkiller to get rid of a headache.
Right.
The relief reinforces the habit of taking medication when you have a headache.
That's a great example. I never thought of it that way.
Yeah.
It's not about punishment. It's about removing something unpleasant
Exactly.
to make the behavior more likely.
Right.
Okay, what other learning paradigms are in the behavior therapy toolkit?
Another big one is extinction. This involves weakening a habit by withholding reinforcement.
Okay.
So if that good dog stops getting treats for sitting, they'll eventually stop sitting on command.
Right.
You're breaking the link between the behavior and the reward or relief.
Right.
And then there's reciprocal inhibition, a particularly clever technique.
Okay.
It's about weakening a habit by activating a response that's incompatible with it.
Okay.
The classic example is using relaxation techniques to counter anxiety.
So it's almost like fighting fire with fire.
Yeah.
You can't be relaxed and anxious at the same time. You're
Right.
replacing one response with another.
Exactly. Wolpe also discusses retroactive inhibition and
Okay.
transmarginal inhibition.
Ooh, those sound intriguing.
Yeah.
What are those all about?
So retroactive inhibition involves replacing incorrect cognitive associations with with correct ones.
Okay.
So think of it like correcting a factual error in someone's thinking.
Okay.
By repeating the correct information,
Yeah.
you weaken the hold of the incorrect association
Right.
and the habit that stemmed from it.
So it's like myth busting, but for your own brain.
Yes.
What about that transmarginal inhibition technique?
That's also known as flooding.
Okay.
It involves prolonged exposure to the anxiety-provoking stimuli
Okay.
to eventually weaken the response.
Got it.
So it's like that saying about jumping in the deep end to learn how to swim.
Right.
It's about pushing past that initial fear and realizing you can handle it.
I can definitely see how that could be helpful for some people.
Yeah.
But I imagine it needs to be done very carefully and ethically.
Absolutely. It's not a technique for every situation or every person.
Right.
And that brings us to another important point. Wolpe really emphasizes that thorough assessment is key
Okay.
before starting any treatment.
Right.
You really need to understand the individual's specific triggers and responses, their own personal anxiety landscape.
So it's like detective work. Mapping out each person's unique patterns.
Exactly.
Right, that.
And once you've mapped out that landscape,
Yeah.
you can choose the right tools from that behavior therapy toolkit we've been talking about.
And when it comes to phobias and anxieties,
Yeah.
it sounds like systematic desensitization is a major tool.
It is.
How does that work in practice?
So it relies on that principle of reciprocal inhibition we talked about.
Okay.
The therapist helps the patient develop a hierarchy of anxiety-provoking situations,
Okay.
from least to most challenging.
Kind of like a fear ladder.
Exactly.
Okay.
And they learn deep muscle relaxation techniques.
Mm-hmm.
Then, while deeply relaxed,
Right.
they imagine those situations from their hierarchy, starting with the least anxiety-provoking.
So the idea is that you're training your body to react differently to those situations
Yeah.
because you're in a relaxed state while thinking about them. Wow.
And for some, just imagining those situations is enough to achieve a lasting reduction in anxiety.
Right.
Wolpe talks about, a transfer of change from the imagined to the real world.
That's incredible. But I imagine it doesn't work for everyone.
You're right. For some people, imagined exposure isn't enough.
Right.
They need to face their fears head on.
Right.
And that's where in vivo exposure comes in.
So how does that work? Do they just dive straight into the most terrifying situation?
Not at all.
Okay.
It's still a gradual process.
Okay.
The therapist guides them through real life situations, starting small and slowly increasing the intensity.
So it's about taking controlled steps towards facing their fears.
Exactly.
That makes a lot more sense, I'm guessing. For someone with a fear of spiders, you wouldn't just throw a tarantula in their lap?
No.
Are there any other tools besides relaxation for those who might struggle with traditional relaxation techniques?
There's some fascinating alternatives.
Okay.
One technique is called modeling, where the patient observes a fearless model interacting with the thing they fear. It's almost like they're borrowing that person's courage by watching them.
That reminds me of when I learned to ride a bike. I was terrified. But watching my older brother zoom around fearlessly gave me the confidence to try. And you know what? It worked.
All right.
It was like his fearlessness rubbed off on me.
That's a perfect example of modeling in action.
Yeah.
And for those who can't relax, there are other options like electrical stimulation,
Okay.
which uses a little shock to interrupt the anxiety response.
Wow.
Or even using pleasurable imagery
Okay.
to create positive emotions that compete with the fear.
Wow, the toolkit just keeps getting bigger. But is it all just phobias?
Right.
Does this approach apply to other issues as well?
Oh, absolutely. We focused on phobias so far.
Right.
But behavior therapy can address a whole range of problems.
Yeah.
For example, agoraphobia is often more complex than a simple fear of open spaces.
Right.
Behavior therapists will delve into those underlying fears
Okay.
to tailor the treatment.
So it's about understanding what's really driving the fear of being out in the open,
Right.
not just forcing someone to go outside.
Exactly.
And for those struggling with being too timid, assertive training can be incredibly helpful.
Oh, absolutely.
Assertiveness, the art of speaking your mind. How does that fit into the behavior therapy picture?
Well, think of it this way.
Uh-huh.
Often, Timid people hold back because of conditioned fears,
Okay.
whether it's fear of conflict or disapproval.
Right.
Assertive training helps them overcome those fears by teaching them to express themselves effectively and appropriately.
So it's about equipping them with the tools and the confidence to set boundaries and voice their needs.
Precisely. It's a process of reciprocal inhibition by expressing themselves assertively. They're
Hmm.
inhibiting their anxiety
Right.
and positive reinforcement
Yeah.
because they see that speaking up can lead to positive outcomes.
Yeah.
It's a win-win.
I'm really starting to see how all these pieces fit together.
Yeah.
Now, what about something like sexual issues?
Okay.
Can behavior therapy really help with that?
It can indeed.
Okay.
For men experiencing, erectile dysfunction or premature ejaculation,
Right.
the therapy often focuses on using the sexual response itself to inhibit anxiety.
Hold on. How does that work exactly?
Well, the sexual response is largely a parasympathetic function,
Okay.
which is the opposite of that fight or flight response that fuels anxiety.
Right.
So by gradually engaging in sexual activity,
Mm-hmm.
and ensuring anxiety never outweighs arousal,
Right.
they can slowly overcome those anxieties.
Wow.
It's a process of retraining the body's response.
That's amazing. It's like using pleasure to rewire those anxiety circuits.
Yeah, in a way.
And what about women who experience sexual difficulties?
Yeah.
Is the approach similar?
Not necessarily.
Okay.
Wolpe distinguishes between what he calls essential frigidity,
Okay.
which is a lack of response to all men,
Mm-hmm.
and situational frigidity,
Okay.
where the lack of response is tied to a specific person or situation.
So with situational frigidity, it's more about addressing the dynamics within a relationship
Mhm.
or specific anxieties tied to certain circumstances.
Exactly.
But with essential frigidity, especially when there are no obvious physical causes,
Right.
behavior therapy can be really effective.
It can, yeah.
Okay.
It might involve techniques like systematic desensitization
Mm-hmm.
to help overcome negative associations or anxieties that have become linked with sexual stimuli.
So it's about untangling those learned responses.
Exactly.
And creating a more positive and receptive experience.
Exactly. Wolpe even mentions cases where frigidity stemmed from a past traumatic experience,
Wow.
like being frightened during masturbation.
Mm.
It highlights just how much past experiences can impact our present behavior.
That's a powerful reminder. What about other issues like homosexuality?
Okay.
How did Wolpe view that in the context of behavior therapy?
He was very careful to distinguish between the various factors that can contribute to homosexuality.
Okay.
He mentions anxieties toward women, general interpersonal anxieties,
Mhm.
and positive conditioning towards men.
Okay.
It's not about viewing homosexuality as a single problem,
Right.
but recognizing those different dynamics.
So it's a much more nuanced perspective
Absolutely.
and taking into account individual experiences and anxieties.
Absolutely.
What about those other techniques we mentioned, aversion therapy and covert sensitization?
Yeah.
How do those fit into this broader picture?
So they both aim to create an aversive response to unwanted behaviors.
Okay.
Aversion therapy might involve, pairing an unpleasant stimulus like a mild electric shock
Right.
with the undesired behavior.
So it's like creating a negative association,
Yeah.
almost like classical conditioning.
Exactly, and covert sensitization is similar,
Yeah, okay.
but instead of a real stimulus,
Right.
the patient imagines the unwanted behavior while imagining an aversive experience.
Okay.
It's a way of training the mind to associate that behavior with something unpleasant.
It's almost like a mental self-discipline technique.
Yeah, you could say that.
I'm amazed at the range of techniques available. But does all this apply to children as well?
Oh, absolutely.
Okay.
Wolpe dedicates a significant portion of the chapter to behavior therapy with children.
Okay.
He emphasizes that many common childhood issues,
Mhm.
like, bedwetting, soiling, and disruptive behavior,
Mm-hmm.
they can be addressed really effectively using these learning principles.
That makes sense. Children are little learning machines.
They are.
So tell me, how does this approach work in practice with kids?
One fascinating example he gives is the treatment of bedwetting using positive reinforcement.
Okay, I'm intrigued. How do you reward a child for not wetting the bed?
It involves encouraging the child to drink lots of fluids
Okay.
and then rewarding them for progressively longer periods of holding their urine.
Ah, I see. It's about building up that bladder control
Yeah,
and associating it with positive rewards.
exactly.
It sounds so much less stressful than the shame and punishment that used to surround bedwetting.
Oh, absolutely. It's a much more positive and empowering approach.
He also highlights the use of what he calls social reinforcers to address things like excessive crying.
Right.
Social reinforcers, what are those?
The idea is that sometimes
Okay.
even negative attention can reinforce a child's behavior.
Right.
So in the case of excessive crying,
Right.
the therapists had teachers completely ignore any crying that wasn't due to, actual pain or need.
So by withholding that reward of attention,
Right.
they were hoping to extinguish the crying behavior.
Exactly. And the results were pretty dramatic.
Wow.
Within a few days, the crying significantly decreased.
That's incredible.
Yeah.
It makes you realize how powerful even subtle forms of reinforcement can be, especially for kids.
It really does. And Wolpe stresses how important it is to involve parents and teachers,
Yeah.
creating a consistent and supportive environment.
Of course, it takes a village.
Right.
Speaking of speaking of villages, we touched on using behavior therapy with schizophrenia earlier.
Yeah.
I have to admit that surprised me.
Yeah.
I thought schizophrenia was considered purely biological.
That's partly true.
Oh.
And Wolpe acknowledges that.
Okay.
However, he argues that certain behaviors associated with schizophrenia
Mm-hmm.
are learned
Okay.
and thus modifiable.
So it's not about curing schizophrenia, but rather helping people manage
Right.
some of those challenging behaviors that can accompany it.
Precisely. And he shares some fascinating examples, like this woman who had a habit of hoarding towels.
Towel hoarding. I have to hear more about this.
Okay, so she'd been hospitalized for 9 years
Wow.
and had amassed hundreds of towels in her room.
Oh my goodness.
A behavior therapist named Elon came up with an ingenious solution.
Oh,
He had the nurses gradually add more and more towels to her room,
really?
far, far beyond what she could reasonably manage.
So they basically flooded her with towels.
Yeah, you could say that.
I bet she was in heaven at first.
She was thrilled initially,
Yeah.
but as the towels piled up,
Right.
reaching, over 600, they became a burden, creating a sense of aversion.
It's like the saying, too much of a good thing.
Exactly.
Yeah.
Eventually, she started taking the towels out herself,
Oh wow.
and the hoarding subsided.
That's brilliant. They changed her environment in a way that naturally shifted her behavior.
Right.
It's amazing how a deep understanding of these learning principles can lead to such creative solutions.
It really is.
And Wolpe goes on to discuss how this approach can be applied on a larger scale
Yeah.
in what are called operant wards,
Yeah.
where groups of patients are guided towards more adaptive behaviors. Operant wards, what are those?
So they're specialized wards
Mm.
designed for behavior modification programs.
Mhm.
They often use token economies,
Okay.
where patients earn tokens for desired behaviors.
So it's like creating a mini society where good behaviors are incentivized.
Precisely. They can then exchange these tokens
Hmm.
for things like privileges or rewards. Okay.
And these programs have been successful in addressing issues from, incontinence to overeating to encouraging social interaction.
That's amazing. It sounds much more hopeful and empowering than a traditional mental hospital ward.
It is.
So we've seen how behavior therapy can be tailored to different ages and challenges.
Right.
But where does it fit in with the broader field of psychiatry?
Right.
Was it seen as a radical departure from traditional approaches?
It definitely represented a shift in perspective.
Okay.
Wolpe argues that once you recognize that unadaptive behavior can be, biological or learned, it makes sense to use our knowledge of learning to address those learned behaviors.
So instead of just talking about problems, behavior therapy is about taking concrete steps to
Yeah.
change them.
Exactly.
And he points out that for neuroses, at least, behavior therapy often achieves faster and more lasting results compared to psychoanalysis.
Right. which was the dominant approach at the time.
Hmm.
There's always that criticism that behavior therapy only addresses symptoms, not the underlying causes.
Right.
How does Wolpe respond to that?
He tackles it head on.
Okay.
He argues that there's simply no evidence to support the idea of relapse or symptom substitution
Okay.
in those who've successfully completed behavior therapy.
Mm-hmm.
You know, the changes are real and lasting.
That's very reassuring.
Yeah.
It makes me think about how we often focus on the why behind our struggles,
Yeah.
but maybe sometimes just focusing on the how to change them
Right.
can be incredibly powerful.
It's a fascinating thought, isn't it?
Yeah.
And while this chapter focuses on clinical applications,
Mm-hmm.
you know, understanding these basic learning principles
Right.
can be incredibly empowering in everyday life as well.
Yeah.
It's not just for therapists, it's for all of us.
Now that's an idea I love. It makes you wonder how many of our daily struggles, from procrastinating to mindless snacking,
Mm.
are driven by these same learning principles.
It's true.
And if we understand those principles,
Yeah.
could we take more control of our lives?
It's a great question to consider.
Yeah.
We often go through life on autopilot,
Right.
but behavior therapy reminds us that
Yeah.
we have the power to shape our habits
Right.
and ultimately our destinies.
That's a powerful message to end on. We've covered so much ground,
We have.
from the basics of behavior therapy to its wide-ranging applications.
Yeah.
It's clear that there's a lot more to explore,
Yeah.
but I already feel like I have a whole new lens
Yeah.
for understanding myself and the world around me.
It's been a pleasure diving deep with you today.
Likewise.
I'm excited to continue this exploration.
And to our listeners, we'll be back soon for part 2 of our deep dive into Joseph Wolpe's work. In the meantime, I encourage you to pay attention to your own habits, both big and small.
Right.
Notice those patterns.
Yeah.
And ask yourself what's reinforcing them.
Exactly.
You might be surprised by what you discover.
Absolutely.
Welcome back to the deep dive. It's amazing how much we've already learned about behavior therapy from just one chapter by Joseph Wolpe.
I know, right?
Wow.
He really lays out a broad view of this approach, and we've only just scratched the surface.
And I love how he emphasizes that behavior therapy isn't a one-size-fits-all approach. It's about tailoring the techniques to each person's unique needs and challenges.
Absolutely. And speaking of unique challenges, we were talking about how behavior therapy can be used with children and even people with schizophrenia.
Yes, and Wolpe gives some really interesting examples of how it's been applied successfully in those contexts.
I was particularly struck by the example of using stimulus satiation to address the woman's towel hoarding. It's such a creative way to use a learning principle to change behavior.
Me too. I'm so curious to hear more about how behavior therapy can help children. It feels like understanding these principles early on could be a real game changer for preventing negative patterns from taking root.
It absolutely can, and it's not just about addressing problematic behaviors. It's also about encouraging those positive habits we want to see.
Right, like that example we discussed where teachers used social reinforcers to reduce a child's excessive crying. It seems counterintuitive at first,
Right.
but it's fascinating how effective it can be.
It is fascinating. It really highlights how powerful attention can be, even when it's negative.
Yeah.
And there's so many other examples of how positive reinforcement can be used with kids.
Oh, okay.
Things like sticker charts to reward chores or good behavior can go a long way.
Those sticker charts were definitely a staple in my house growing up.
Yeah.
I think any parent can relate to that. But I have to ask about the critics who say this is just bribery.
Right.
Doesn't it create a dependence on external rewards instead of teaching kids intrinsic motivation?
That's a common concern.
Yeah.
But Wolpe argues that it's a misunderstanding of how positive reinforcement actually works.
Okay.
It's not about creating a dependence on those external rewards. It's more like using them as a stepping stone
Mm-hmm.
to shape behavior in a way that leads to internal satisfaction.
So you start with the external rewards, but the goal is to eventually foster that internal motivation.
Exactly. Think about learning to ride a bike.
Okay.
At first you might need training wheels
Right.
or parent holding on,
Yeah.
but eventually you find your balance.
Mm.
And the joy of riding comes from the experience itself,
Yeah.
not from someone cheering you on.
I see what you mean. It makes me think about how even adults often rely on external reinforcement, even if we don't always realize it.
Yeah.
Like that feeling of satisfaction you get when you check something off your to-do list.
Right.
Those external motivators can keep us moving forward.
Precisely. It's about
Right.
using those tools strategically to build positive habits.
Now, when it comes to those more challenging behaviors in children, things like aggression or defiance,
Yeah.
can behavior therapy help with those as well?
Absolutely. And one of the key techniques is something we all know, timeout.
Okay. Most parents are familiar with the concept of timeout,
Right.
but how does it fit into the behavior therapy framework?
It's based on the principle of extinction. By removing the child from a situation where they're getting attention or reinforcement for their negative behavior,
Right.
you weaken the link between the behavior and its consequences.
So it's not about punishment, but about taking away those rewards that
Right.
that might be fueling the behavior.
Exactly.
Yeah.
But it's crucial to use timeout effectively. It shouldn't be, done in anger or with shame. It's about creating a neutral space
Right.
for the child to calm down and reflect.
I imagine it's also important to talk to the child afterward to help them understand why the behavior was problematic and,
Right.
and what they can do differently next time.
Absolutely. It's about teaching them those valuable emotional regulation skills
Mm-hmm.
and helping them make better choices in the future.
Yeah.
It's not just about stopping the behavior in that moment. It's about giving them the tools to handle similar situations more effectively down the road.
So it's a learning opportunity for the child, not just a punishment.
Precisely. It's about guiding them towards those positive behaviors we want to see. And this idea of guiding behavior through learning principles,
Yeah.
it applies to adults too.
Ooh, that's interesting. You're making me think about all those self-help books and techniques out there.
Right.
Are you suggesting that many of them are tapping into these same behavior therapy principles, even if they don't explicitly say so?
It's definitely something to consider.
Yeah.
Many techniques for building good habits or breaking bad ones are rooted in these same learning principles.
Mm-hmm.
Think about things like setting clear goals,
Right.
rewarding yourself for progress,
Yeah.
or breaking down a large goal into smaller, more manageable steps.
That's a really fascinating point. It makes you wonder how much of what we consider common sense is actually based on these underlying principles of learning. It's
Yeah.
it's like we're all amateur behavior therapists in a way.
I love that perspective.
Yeah.
It reminds us that we have more power over our habits and behaviors than we often realize.
Speaking of which, I want to circle back to the use of behavior therapy with schizophrenia.
Okay.
You mentioned that example of the woman who hoarded towels, which really stuck with me.
It's a great example of how understanding these principles can lead to creative and compassionate solutions.
And you also mentioned something called operant wards,
Right on.
where these principles are applied on a larger scale. Can you tell me more about that?
So opera wards are designed to create a very structured environment
Okay.
where positive behaviors are consistently reinforced.
And if I remember correctly, they often use something called token economies.
Right.
Where patients can earn tokens for engaging in desired behaviors.
Exactly. It's like a system of positive reinforcement in action.
Mm.
Those tokens can be exchanged for privileges, rewards, or even, tangible items.
So it's about creating a system that incentivizes and recognizes those positive behaviors.
Precisely. And these programs have actually been quite effective in improving the lives of people with schizophrenia.
That's incredible. In what ways have they seen improvements?
Well, for instance, studies have shown that token economies can help reduce disruptive behaviors.
Hmm.
Increase self-care skills,
That
and even improve social interaction among patients.
that's really remarkable. It challenges the traditional view of schizophrenia as an untreatable illness.
It does,
Yeah.
and it highlights the potential of behavior therapy to empower individuals to live fuller lives.
Yeah. Even in the face of significant challenges.
Now, I can't help but wonder about the ethical considerations of using these techniques in this context.
Sure.
Are there concerns about manipulating people's behavior?
Those are important questions.
Yeah.
And Wolpe certainly acknowledged them.
Okay.
He was a strong advocate for using these techniques ethically
Right.
and always with the patient's best interests at heart.
So it's not about controlling people,
Oh,
but about empowering them.
exactly. It's crucial to ensure that the rewards and consequences are meaningful to the individual
Mhm.
and that they have a voice in their treatment plan.
Yeah.
It's a collaborative process,
Right.
not one of coercion.
That makes sense. It's about respecting their autonomy
Right.
and working together to achieve their goals. It's not about trying to fit everyone into the same mold.
Exactly. It's
Yeah.
it's about helping people identify and change the specific behaviors that are causing distress
Hmm.
or interfering with their ability to live a fulfilling life.
I think that's a really important point. It's not about trying to make everyone normal, but rather helping them find what works best for them.
Exactly. And it's about recognizing that everyone, regardless of their diagnosis or challenges,
Right.
has the capacity to learn and adapt.
No, that's a message of hope and empowerment I can get behind.
Yeah.
Behavior therapy reminds us that we're not just products of our past or our biology.
Right.
We have the power to shape our own lives.
I couldn't have said it better myself. It's
Yeah.
it's fascinating to think about how these same principles we've been discussing can be applied in so many different areas of life.
It's true. We've talked about children and schizophrenia, but I'm curious to delve deeper into some of those specific techniques that Wilpa outlines for addressing various issues.
Okay. Yeah.
Techniques like systematic desensitization,
Hmm.
aversion therapy, and modeling. There's
Nice.
there's so much to explore.
I'm with you. I'm ready to dive even deeper into that behavior therapy toolkit.
Fantastic. We'll pick up right where we left off in the next part of our deep dive.
Okay.
Until then, dear listeners, take a moment to think about your own habits.
Yeah.
What are some things you'd like to change?
Right.
Knowing how these learning principles work
Yeah.
can give you a real sense of control over your life. Welcome back to the deep dive. I don't know about you, but after exploring the world of behavior therapy with Joseph Wolpe's work, I'm starting to see learning principles everywhere. It's like I've unlocked a secret code to understanding people.
Yeah, I know exactly what you mean.
Yeah.
How much insight we can get from just understanding those basic learning principles.
Right.
Today, I want to delve into some of the specific techniques that Wolpe describes.
Yeah.
We've touched on them briefly, but I'd love to unpack them a little further
Sure.
and get your take on their application.
Let's do it.
Well, systematic desensitization really caught my attention. I can see how it will be so helpful for phobias,
Right.
but I'm curious to hear more about how it actually works in practice.
Yeah, it's such an elegant technique, really. The basic idea, as we discussed, is to gradually expose the person to their fear while they're deeply relaxed.
Right.
Using that relaxation response to counteract the anxiety.
So they're retraining their body to react differently to that feared stimulus.
Right.
It's like teaching their nervous system to hit the brakes when that fear kicks in.
Exactly. And one of the key elements of systematic desensitization is that hierarchy we talked about, that fear ladder.
Right. You start with the least anxiety-provoking situation,
Right.
and you work your way up step by step to the most challenging ones.
Right. It's about taking those controlled, gradual steps so the
Mm.
person never feels overwhelmed.
Right.
Can you give me an example of what a hierarchy might look like?
Of course. So let's say someone has a fear of public speaking.
Mm.
Their hierarchy might begin with imagining themselves standing alone on a stage.
Okay.
then picturing a few people in the audience,
Hmm.
then a full auditorium,
Yeah.
and finally, delivering a speech to that large crowd.
So each step builds on the last,
Right.
gradually increasing the intensity.
Exactly.
And the whole time they're practicing those relaxation techniques
Right.
to counter that fear response.
Precisely. And as they master each step, their confidence grows.
Right.
And the anxiety associated with public speaking starts to diminish.
Yeah.
It's like they're slowly chipping away at that fear one step at a time.
I can see how that would be incredibly empowering,
Yeah.
but it also seems like it would require a lot of trust and rapport
It does.
between the therapist and the patient.
Absolutely. The therapist's role is crucial in guiding the patient through each step,
Right.
creating a safe and supportive space for them to confront those fears.
Now, what about those individuals who struggle to relax, even with guidance?
Mhm.
Are there alternative approaches for them?
There are. Wolpe discusses a technique called in vivo exposure, which involves confronting the feared situation in real life
Okay.
rather than just imagining it.
Okay, that sounds a lot more intense.
It can be.
But I'm guessing it's not about just throwing someone into the deep end of their fear
No, not at all.
right away.
It's still a gradual process,
Oh, yeah.
starting with situations that provoke very little anxiety
Mm,
and slowly increasing the intensity as the person gains confidence. It's about those baby steps.
right.
But this time they're happening in the real world.
So for someone with a fear of spiders, you might start by having them, look at pictures, then watch videos,
Right.
and eventually, work up to being in the same room as a spider,
Right.
all while providing support and guidance along the way.
Exactly. The therapist is there every step of the way, making sure the person, feels safe and in control.
It sounds like a really powerful way to overcome those deep-seated fears that can really hold people back in life.
It can be incredibly transformative. And there's another technique that Wolpe mentions that I find fascinating. It's called modeling.
Mm-hmm.
It's where the person learns by observing a fearless model interacting with the object or situation they fear.
So it's like they're learning by example, seeing that it's possible to approach that feared thing without being afraid.
Exactly. And oftentimes that vicarious experience can be enough to start to reduce their own fear.
Yeah.
It's almost like they're absorbing some of that model's
Oh,
confidence.
wow, that's incredible. It makes you wonder how much we learn through observation and imitation, even without realizing it.
I know. It speaks to the power of social learning.
Yeah.
And modeling isn't just limited to phobias. It can be applied to a wide range of behaviors.
Right.
Think about learning a new skill, for instance.
Okay.
Sometimes watching someone else do it first can make it so much easier to grasp.
That's so true. It's like that saying, monkey see, monkey do.
Exactly. We're wired to learn from each other.
Now, shifting gears a bit, what about those everyday habits that so many of us, struggle with?
Right.
Things like nail biting or procrastination.
Yeah.
Does behavior therapy have any techniques for those more common challenges?
It does, yeah.
Yeah.
And one of the most effective techniques is called habit reversal training.
Okay, that sounds promising. How does that work?
So the first step is becoming aware of the habit.
Hmm.
You really have to pay attention to when it happens, what triggers it, and the specific behaviors involved.
So it's like becoming a detective of your own habits.
Precisely.
Yeah.
Once you've identified the triggers and behaviors,
Yeah.
you learn a competing response,
Yeah.
something that's incompatible with the habit.
Okay.
So, for example, if someone bites their nails when they're anxious,
Right.
they
Yeah.
might learn to clench their fists or squeeze a stress ball instead.
So by consistently engaging in that competing response,
Right.
the habit gradually weakens,
Right.
and eventually disappears.
Yeah,
Like you're retraining your brain to react differently to those triggers.
You are.
That makes a lot of sense. It highlights the idea that we're not powerless over our habits.
Right.
We can learn to change them.
We can, and that's a really empowering message. But it's also important to acknowledge that not all not all habits are created equal.
Mhm.
Some habits like addiction can be incredibly challenging to break, even with professional help.
You're right. And it's important to remember that behavior therapy isn't a magic bullet.
Right.
It's a tool
It is.
and a very effective one,
Yeah,
but it often requires effort, commitment, and guidance.
absolutely. It's about working in partnership with a skilled therapist
Right.
to develop a personalized approach.
I'm also curious about those situations where behavior therapy might not be the best fit.
Yeah.
What are your thoughts on that?
Well, if someone is struggling with deeply rooted trauma or complex emotional issues, for example,
Mm,
um, a more insight-oriented therapy might be a more appropriate path.
okay.
It's not about, seeing behavior therapy as a solution for everything, but
Right.
but about recognizing its strengths and limitations.
It's about finding the right tool for the job, so to speak.
Exactly.
Yeah.
And ultimately the most effective approach is going to be, tailored to the individual
Right.
and their unique needs.
Now, taking a step back for a moment,
So yeah,
I'm curious about the broader implications of Wolpe's behavioristic view.
okay.
It seems like it challenges those traditional ideas about free will and personal responsibility.
Hmm.
If our behaviors are largely, products of conditioning,
Right.
where does that leave our sense of agency?
It's a really fascinating question.
Yeah.
Behaviorism sometimes gets a bad rap for being deterministic.
Right.
But I think it's more nuanced than that.
Oh.
It's not about denying the existence of those internal states
Mhm.
or the complexity of the human experience.
Right.
It's about recognizing the powerful influence of learning and conditioning
Yeah.
on our behavior.
So it's not about saying we're robots, but acknowledging that we're shaped by our experiences.
Exactly. And I think this perspective can actually be quite empowering.
Really? How so?
Well, if our behaviors are shaped by learning, then we have the power to unlearn those behaviors that aren't serving us
Right.
and learn new more adaptive ones.
Yeah.
It's not about being trapped by our past,
Right.
but about recognizing that we can change and grow.
I love that perspective.
Mhm.
It's like taking that idea of determinism and flipping it on its head.
Right.
Instead of limiting us, it opens up possibilities for change and growth.
I couldn't agree more, and I think that's one of the most powerful and enduring aspects of behavior therapy. It's not just a set of techniques. It's a whole way of understanding ourselves and the world, of philosophy that reminds us that we are capable of change.
That's a beautiful way to put it, and it's a message that resonates deeply with me.
It's been an absolute pleasure exploring these ideas with you today.
It's been an incredible journey.
It has.
We've covered so much ground.
We have.
From those basic learning principles to their far-reaching applications,
Yeah.
and I feel like I've gained a whole new appreciation for the power of this approach.
Me too. It's been fascinating to dive deep into Wolfie's work
Yeah.
and see how his insights continue to shape our understanding of human behavior.
And to you, our listeners, I wanna leave you with this thought. The next time you find yourself engaging in a habit, whether it's, biting your nails, procrastinating, or even just mindlessly scrolling through your phone,
Yeah.
pause for a moment
Oh,
and ask yourself what's reinforcing this behavior?
mhm.
What triggers it?
Right.
And most importantly, is this a habit that's truly serving me?
That's a great question.
By understanding these learning principles, we
Yeah.
can we can become more conscious architects of our own lives, shaping our behaviors
Mhm.
in ways that lead to, greater well-being, fulfillment, and connection.
Beautifully said. And remember that journey of self-discovery and change is ongoing. There's always more to learn, more to explore and more to create.
Thank you for joining us on this deep dive into the world of behavior therapy.
Yes, thank you.
We'll see you next time for another fascinating exploration.